All right, today we're going to pull back the curtain on something you've almost certainly seen, but probably never really understood. We're talking about those mysterious little codes on your medical bills. Yep, CPT codes.
You know what I'm talking about, right? You get a bill in the mail, you're looking it over, and next to something like office visit, there's this weird number, 99213. You just kind of glance past it, thinking it's some internal billing thing, but it's so much more than that.
What if I told you that simple 5-digit number is actually a keyword in a universal language? A language that connects doctors, hospitals, insurance companies, the whole shebang. It's a language that drives billing for sure, but it also fuels cutting-edge research, and, as we're about to see, it can have a massive impact on patient care. So, let's start decoding.
First up, let's look at the code on your bill.
This really is medicine's universal language. So, CPT stands for Current Procedural Terminology. The best way to think of it is like a giant dictionary, created and updated by the American Medical Association. And in this dictionary, every single medical service you can imagine, from a simple checkup to complex heart surgery, gets its own unique code. That standardization, that's the magic key that makes the entire system work. And this system has been around for a while. The AMA put out the first version way back in 1966. But the real game changer? That was 1983. That's when Medicare adopted it. And boom, it instantly became the national standard. From there, it just grew and grew into the massive system we have today, with over 10,000 codes covering pretty much everything in modern medicine.
Okay, so those 10,000 plus codes aren't just one giant messy list. They're actually neatly organized into 3 very distinct categories of care.
It all breaks down pretty logically. Category I is the workhorse. These are your standard 5-digit codes for common procedures, like our friend 99213, and these are the ones tied directly to billing and reimbursement. Then you have Category 2. These codes end in an F, and they're different. They don't get you paid, instead they track the quality of care. Think of a code that shows whether a doctor checked a diabetic patient's foot. And finally, Category 3 codes, which end in a T. These are for emerging, innovative technologies. This is how the system makes room for the future, gathering data on new procedures before they become mainstream.
But here's where it gets really interesting, because this is about so much more than just billing. This is how these little codes lead us from raw data to incredible discoveries.
See, to get the full picture of a patient's story, you actually need 2 pieces of the puzzle. You've got ICD codes, which you may have heard of. They explain why a patient needs care. That's the diagnosis, like diabetes. But CPT codes tell you what was actually done for them, the procedure, like a blood test. So think of it this way. One code is the problem, the other is the solution.
Now imagine combining the why and the what, not just for one patient, but across millions of anonymous patient records. Suddenly you have this incredible power to see the entire patient journey, from the very first symptom all the way to the final outcome. It's almost like having a detailed map of the entire healthcare landscape.
And when you can map out that entire journey at a massive scale, well, that's when you can start using this data to not just improve care, but to actually save lives. Take a look at this. CPT codes can map out a super complex journey like breast cancer with amazing clarity. You see code 77067, that's a mammogram. Then 19301, that's a lumpectomy. Next up is 96413 for chemotherapy and 77385 for radiation. What was once a complex, overwhelming disease becomes a clear, step-by-step pathway that we can actually analyze.
So that's incredible, right? But how do we actually make the leap from just mapping these pathways to improving someone's health and well-being?
You do it by looking for what's missing. In one absolutely amazing real-world analysis, researchers scanned patient data to see which diabetic patients were missing the CPT code for their annual eye exam. By identifying that gap, that missing step in their care, they could reach out and get those patients screened. The result? 230 people were protected from potential, life-altering vision loss. That's a direct, tangible impact on human lives, all found by analyzing these codes.
It also helps us prove what's working. For instance, when a new drug for Crohn's disease was released, analysts tracked its CPT code in a huge patient database. And what they found was stunning. Patients taking the new drug had a 32% drop in hospitalizations, a 45% reduction in surgeries, and fewer ER visits. Now, this isn't a clinical trial in a lab. This is real-world evidence. It proves the drug's value and helps make the case for more patients to get access to it.
So, where does all of this go from here? Well, it's pretty clear. The future is coded. You know, the CPT system is anything but static.
It's constantly evolving. New codes are being created right now for things like telemedicine and remote patient monitoring. Those Category 3 codes we talked about, they're paving the way for AI-powered diagnostics. And as we move deeper into the worlds of precision medicine and genomic testing, you can bet that CPT codes will be there to track and measure it all.
So the next time you see that 5-digit number on a medical bill, I hope you'll remember it's so much more than just a charge. It's a single word in the universal language of medicine. And this quote just says it all perfectly. Without that language, our data would tell us about the problem, but not the solution, the disease, but not the care. It's the code that tells the other half of the story.